the charity that I started is called the Rogue Rouge Foundation. But I also do a lot of independent work as a facilitator and a speaker, helping communities create a sense of connection and unify them to create change. I started to experience the onset of my challenges at probably 12 or 13, but because, we're going back 12 years ago, mental health wasn't talked about nearly as much as it is today, even though I still think we've got a long way to go. I didn't understand the symptoms that were really evident. I felt confused as to what an anxiety attack was, and yet I was having one pretty much every day. And feelings of lethargy and lack of concentration, which were clear indicators that I was struggling with depression. And because no one was openly discussing or having that conversation, it made it not only really difficult for me to talk about it, but I didn't even have a language for it. From the outside, everything looked amazing, and yet I felt like every day this shadow sort of grew and grew the more that I didn't talk about it. And I think that that's an experience that so many people can relate to. What are the things that we lock away that we feel like we either don't know how to talk about, or we feel afraid that people are going to judge us or see us differently if we do talk about them. At 14, I left school, a mainstream school, to go to a performance academy. Undeniably, one of the best experiences of my life, but I didn't understand how to deal with that pressure. And with that came a certain level of comparison and a lack of understanding how to manage my own stress and self-talk and sense of self. And all of these things I now know are skills that can be taught. We can teach them to anyone, but especially young people. And it is so, what happened to me or what I went through could have easily been prevented. And it was simply because there wasn't access to having these conversations. I was diagnosed with anorexia when I was 16, but I had the symptoms of the eating disorder for years before my official diagnosis. And what I experienced was people only being able to talk to the illness. And it's like, it was one of the most dehumanizing times of my life, because I was still in there. My greatest, brightest self was still there somewhere. But every interaction I had with people, they could only see the illness. And it separated me more and more from the people that really could have been the biggest supporters, which was the community around me. At 21, I was appointed as the youngest National Mental Health Commissioner in history, actually the youngest commissioner in history. And it was a really, it was such a, profoundly humbling, but also incredibly insightful journey for me to go on, because I came from such a grassroots background of advocating for change on the ground, literally going into communities and getting my hands dirty with the community. And then I was offered this opportunity to see things from a whole different level, which was amazing. And I think our politicians get given a hard time. They're trying to do a good job. No one goes to work and tries to do a bad job every day. But what is really striking, I guess, as someone that's had such a connection to community, is the disconnect. And the disconnect's very real. And I think in my work, I've had the privilege of being able to see where the disconnection in communication really stems from. And unless those people at the top are really taking the time to connect to communities, they can't really make informed decisions on their behalf. And yeah, I'd like to think that I'm a bit of a bridge in that way. Yeah, I want to do this forever. This is my life's work. This is what feeds me.